Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about how to obtain medical insurance referrals for your clinic. Referrals are very important depending on the insurance that patients have and which specialty you're in. The referrals are required to ensure that the services, the appointments that are being received by the patient essentially is going to be reimbursed and that it's covered under their plan. If a practice does not obtain a referral and it's required, you would be out that money. So it's really, really important financially that these referrals are obtained and confirmed that you have them and they're valid. By the end of this video, you're going to understand how to correctly obtain the referrals, why they're needed, to help you avoid the denials that can come with it, and make the process smoother for your practice and staff. So what exactly is a referral? It's an authorization from a patient's insurance for the patient to be seen, okay? And usually it's initiated by the primary care provider to see a specialist of some sort. And it could also be for diagnostic imaging, but usually that is going to go more into the prior authorization mode, okay? So the difference between usually a referral and a prior authorization is that a referral is like a permission slip. It's a permission slip from the primary care with the insurance approving the request to see a specialist, where a prior authorization is going to be for a specific service, a specific medication, something like that. It's going to be the next level. So let's say your primary care tells you that you need to go see an orthopedist. Your insurance approves you to go see the orthopedist, but then your orthopedist tells you that you need an MRI. So then the orthopedist office is going to obtain the prior authorization for that MRI because the referral does not cover that, okay? So most HMO and POS, it's not what you think, POS, get that out of your head. Those are going to be the most likely insurance plans that are going to require referrals, okay? For a patient to see a specialist, they need authorization through a referral, a permission slip, okay? Think of it that way. A lot of managed care plans, like Medicaid managed care plans, are also going to be the same way because it helps them manage costs. So these types of plans that patients sign up for, HMOs, POSs, managed care plans, they're going to be exactly that. They're managed. So they want to make sure that the money that is going to pay for services is going to be doing what it's expected to do, which is only provide necessary services to that patient, okay? So who is responsible for obtaining the referral? And this is a really good question. And usually the PCP of the patient issues the referral, okay? So a lot of times the PCPs will have an insurance portal for every insurance that they go into, and they initiate these referrals. And they have to give certain information like diagnosis codes, reason for the patient being requested to see the specialist, what they're hoping to rule out, what they've tried so far maybe. Sometimes it's not that detailed, but it could be. I've had that experience myself when I've been putting these in for patients. So it just depends on the individual insurance's requirements in order to request that referral and for them to approve it. And then the specialty clinic who the patient is being referred to is going to be responsible for making sure that the referral is accepted by the insurance and that it is valid. So the patient's going to be scheduled within the valid dates that are provided, that they're only scheduled for what was approved a lot of times, things like that. And then Ideally, the front office of the specialty practice should be verifying when they schedule these patients that a referral was obtained. They put the referral information in the system. If there's a referral number required, that's tied to the appointments for the billing, and it's all taken care of before the patient is seen. The one thing a lot of people don't realize is that a referral must be obtained before the patient is seen. You can't see the patient and then say, oh, by the way, I needed a referral. Back in the old days, there was a lot more grace in this, and the insurances would be like, oh yeah, we'll backdate the referral, not a big deal. No, that's not how it works anymore. A patient has to have a referral on file before their date of service, before they will pay anything. So that is something to be mindful of. And some plans will give like so many visits are authorized with a specialist, where others will say it's so many visits within this certain time span. So there's an expiration date of using up those. And then some of them will just do a time span. So yes, this referral is good to be seen as many times as needed until whatever 6 months is out or a year. So it's important, and you'll identify trends as you get them of which insurances do it which way, but you need to be looking see if they have a quantity limit. You have to see if there's a time frame limit, and make sure you notate all of that in your accounts. The one thing that's great about a lot of the newer EMR systems is a lot of them have tracking capabilities that will tell you when the referral is going to expire, or if it's expired, or if your counts are getting low and they prompt you to submit for renewed amount of visits. So that's really nice. So how to obtain a patient's referral? Well, one, you need to look at the patient's plan, and you need to see what kind of insurance they have. If it's a PPO, most likely they don't require a referral. But anything else other than a PPO, you need to dig a little bit deeper to see if their insurance requires referrals. Sometimes the insurance card will tell you referrals are required. Other times you're going to have to go in and check their eligibility and benefits information and find out if they require a referral. And then you need to, if you're in the specialty office and you see they require a referral, you need to go and contact the primary care to see if they've already initiated it. If they have, then just ask for them to send you the confirmation and approval permission slip. But if they haven't, then you need to request that they initiate it, and you can't schedule that patient yet. So you kind of put them on hold and explain to them that you're waiting on the primary care, okay? A lot of people used to fax the referrals, and people still do that, but now with all of these other capabilities with the P2Ps, like you can get stuff electronically sent to you from EMR to EMR. A lot of times we do that, or you could just go into the payer portal and see it there if you have access, and download it and upload it into the patient's chart that way as well. When you receive the referral from the specialty side, you want to make sure that you verify all the information is correct. And I've seen this happen a lot, where the front office or whoever's scheduling the patient takes for granted that the referral information is true and accurate, and it can cause denials. So just because the primary care put it in, don't take for granted that they did it correctly. No offense to the primary care, but what happens if the primary care referred them to one doctor in your practice, but that doctor's schedule is really far out and the patient wants to be seen sooner, and another provider at your practice has availability? You would have to go in and have the name on that referral changed from the original specialist to the new specialist, because it's very, very specific. You can't just give just an orthopedic something practice referral. It has to usually be the specific provider they're seeing's name on the referral. I have seen this a lot on referrals where staff at the specialty office is not verifying that the dates are accurate, the provider's name is accurate, the specialty is accurate. They're not seeing if there's a referral number in there or authorization number in there. They're not seeing the visit count. So all of those details need to be reviewed and verified before you move forward with scheduling the patient, okay? It is the specialty practice responsibility for that. And then you want to make sure, of course, that you upload and enter all the information into your EMR so that the patient's chart is updated, and anybody that needs to reference it will be able to do that. And that the information is also linked to every appointment in which they're seen, because a lot of systems will take that information and populate it onto the claim where it's required so that they get paid and processed quickly. Managing and tracking referrals can be tricky. Hopefully your practice management or EMR system will have the electronic capabilities to do this. And if you're not sure, contact them, ask for demos or trainings on it if they do. Manual processes like we used to do back in the day of having like a folder and keeping them in chronological order or an Excel sheet, those can still be done. However, it's not as efficient as doing it electronically. So use whatever resources you have at your fingertips that will make this more efficient, because it can be very cumbersome, especially if you are in a practice or in an area that has a lot of HMO and POS patients that require referrals. Oh my goodness, you have to have a very streamlined, no gaps SOP in place for your staff to make sure that it's not negatively impacting anybody, including the patient's care, your finances, etc. And if you need any cheat sheets created because your staff is new or you onboard staff and you have to train more staff, I would do that. If you have somebody in your office that's very well versed in reviewing those referrals and verifying the information is correct before they schedule patients, ask them to create the checklist for you. If you're on the primary care side and you're requesting those referrals, ask one of your staff members who are good at this process to put in those step-by-step instructions for other staff. Any cheat sheets you can provide to anybody in your office that's related or could be related to this process is a very good idea, and I highly encourage it. So some common areas I find pitfalls, if you will, with referrals is that there are missing or expired referrals, because that leads to claim denials and no payment. You have wrong specialist names listed on the referral, like I said, so that's invalid for insurance and they'll deny it. You could be using too many visits, like you are over your allotted amount and then you have to submit for renewal, but the ones in the interim are going to be denied, which is terrible. So in order to prevent that, like I said, you need like a checklist for someone to be verifying the validity of these before the patient is seen. You need to figure out how you're going to track those number of visits and who's going to be responsible for submitting for the new amount of visits and in how much in advance, right? Like 30-day advance or something like that. And maybe keep like a sample referral verification form for people to see too, like an example, and highlight the different things that they're looking at with the checklist so it can be related and understood, okay? So know your payer rules, know your patient volume and what kind of insurance they have. Make sure your staff are well trained, whether you're the primary care office initiating those referrals or if you're the specialty office verifying and scheduling those patients. You need to make sure that there's actually some accountability in the office as well. And you want to make sure that everybody is comfortable with this. And if they have any questions, they know who to go to in the practice to help them immediately so they're not making inaccurate assumptions. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. And please share this with anybody who you think would benefit from this information. I appreciate the support and we will see you next time. Bye-bye.